Good afternoon and welcome to today's Kirklees Health and Wellbeing Board on Thursday the 17th of September. Could I welcome all the board members and participants today and remind everybody that this meeting is webcast and recorded. Could I ask board members to keep their cameras on, please? Those in attendance, if you could just put your camera on as and when you're either presenting or speaking, and also ask anybody if you wish to speak or ask a question that you put speak into the meeting chat line so I can see it. You don't need to do anything other than write the word speak because it will show who you are as such. So we'll start off then by asking the governance officer, Jenny, please, if you can let us know of any apologies that we have.
Yes, we've got apologies from Richard Parry, Dr. Khalid Naheem. Those are the two that I've received so far. I understand Carol McKenna is on leave, and that's it, Chair.
Thank you very much. And rather than have everybody try to trot out who they are, if Phil, if you would go through the list of attendees as we are at the moment.
Okay, we've got it's Health Councillor Kendrick, Councillor Pattison, Councillor Pinnock, Councillor Thompson, Councillor Khan, Mel Meggs, Emily Parry-Harris, who's substituting for Rachel Spencer-Henschel, Dr. Steve Ollerton, Ian Currell, who's substituting for Carol McKenna, Jane Close, who's substituting for Karen Jackson, Helen Hunter, Tim Breeden, Matt England, Catherine Riley, Councillor Zaman, and Diane McKerricker.
Okay, thank you. I think we've had notification of apologies for Carol McKenna as well, haven't we now?
Yes, we have now.
Yeah, that's good. Thank you. Can I ask members of the board to have a look at the minutes of the previous meeting that was held on the 16th of July? And really, we're looking for any corrections if anybody finds anything, has found anything that needs correcting. And if not, if we're happy to approve those. So anybody got any sort of corrections, if you could indicate or let me know? I'm not seeing anything. So I'm it's always difficult, isn't it, when I can't see everybody? I can only see a selection of people. Unless somebody now says no or they're not happy, I'm taking it that those minutes are approved. Okay, thank you very much. So now board members must declare any interest that they have on any items on the agenda, and if so, if you could make sure that you let Jenny know before the end of the meeting. And if I don't think there's any particular strong votes as such, but if you could make sure that you don't participate in a vote if in some way you would be compromised by an interest. This meeting is held in public, so there are no items that are to be held in private. So all the items will be addressed and broadcast as they lie in the agenda. So have we any deputations or petitions as such, Jenny?
No, none received.
Thank you. And have we any questions from members of the public?
Again, Chair, no, I haven't received any.
Okay, so that takes us past item 6. So we now come on to item 7, which is the Kirklees Economic Recovery Plan and Inclusive Economy. And I understand Jonathan Nunn is going to be leading on this, and Andrew Sharp is here as well to comment or add anything onto the discussion. So Jonathan, do you want to take us forward with this one, please?
Absolutely. I'm just applying my background effects. And I'll bring up the presentation.
Lovely.
Okay, you should hopefully be seeing the slides now. Great. Okay, so today we're going to look at both the inclusive economy agenda that we have in Kirklees and talk about the economic recovery plan. As well as those headlines, I just want to make the connection of social determinants of health, and particularly linking in with the presentation that you received at the last meeting from Emily Parry-Harris on inequalities. I wanted to say as well that this is something that's quite important to me and almost personal, as I used to work within primary care trusts in strategy in London, and so many of the conversations I was in went back to the issue of wider determinants of health, and found myself actually thinking, okay, well, rather than work within the health sector, actually I'll go and work in the area of economic development and deal with the causes, rather than ending up dealing with the symptoms. And so a few years later, here I am. So just in terms of the social determinants of health and really linking to that experience that I had, I wanted to just mention very briefly the Marmot review and the 10 years on update that came out in February, just before the pandemic really hit. And some of the stats that we saw in terms of the changes in life expectancy and the difference in life expectancy across deprivation really were quite shocking, and particularly seeing that for women in the lowest the areas that fall within the lowest decile of deprivation actually saw a decline in their life expectancy, really drove home the importance of this agenda. And so there were a few recommendations within that report that are central to the work on inclusive economy and become more important in the context of our economic recovery now. So some of these themes you will see within our economic recovery plan around good quality work, around the importance of good wages, the importance of apprenticeships, reducing poor quality work, and issues like 0 hours contracts, and the importance of adopting inclusive growth and social value approaches, which are important to us locally. I then just wanted to share this slide again that I know Emily used last time, just how clear it is that economic factors influence our behaviour and they result in differences in our experience of the health conditions that impact on our lives. Now, our inclusive economy programme in Kirklees works around this 7-box framework. And I just wanted to talk through very quickly how I see this impacting very directly within the health environment and the opportunities that the actors within our health economy have to impact on this. So one of the first things is local spend. Our health providers have significant budgets, which when spent locally can really strengthen our local economy. And using a social value approach in procurement, that can drive positive benefits in terms of strengthening our local supply chains, in creating better work locally, as well as environmental benefits and other impacts locally. The NHS actually has some exemplar practices in terms of good work, and so the importance of the NHS and other health providers within our local economy is actually really strong. The NHS and other providers have significant estates that can be used for community benefit. There are opportunities to look at what poverty proofing access to services mean, and how that impacts on wider health experiences. In terms of grassroots, this really is our VCS. It's about the strength of our local communities. So what are the opportunities to involve the VCS within commissioning and social prescribing as well? Understanding local impact really is about how we use our intelligence, and the NHS creates a wealth of data which allow us to better understand the impact of economic factors on our local communities. And then this final issue of the environmental sustainability, which is what we call it kind of for ease of reading, but actually this is what we've started talking about as a just transition, how we move to have a carbon-free sustainable economy, but move to that in a way that doesn't disadvantage particularly those groups that have been disadvantaged by previous industrial transitions. But issues that the health sector can really impact on are around active travel and active leisure as well, but also in terms of employee progression. I also wanted to link this into the wider West Yorkshire context, and a lot of work was done last year, which I had some involvement in, to ensure that not only the West Yorkshire and Harrogate plans incorporated inclusive growth as being something which is essential to driving good health outcomes, but also building health in as a factor into our local industrial strategy. Now, just moving on to the pandemic, I've got a few stats here. You'll understand that this situation is something that has been incredibly fast moving, and almost every week new stats are coming out which help us to understand this situation a little more and see the picture evolve. I've included as the first stat a projected change in essentially the size of our local economy that came out pretty early on, which saw our local economy potentially contracting by 41%. And all of these stats around workers furloughed, the number of self-employed residents who received support through the government's programs, the increases in benefit claimants, all of these are incredibly important statistics and demonstrate how significant these impacts have been. But also, it's worth noting that this week we had new GDP figures come out, which suggested that in July, the growth was much greater than expected. And so our economy is now 11.7% smaller nationally than it was in February, which can be looked at in two ways. On the one hand, it's much better than we anticipated seeing, say 3 months ago. But on the other hand, if we were talking about any other economics, any other recession, actually we would be looking at 12% of GDP being catastrophic. So there's some kind of a silver lining to that cloud. Now we've put together an economic recovery plan which was signed off by Cabinet in July. And this was put together as part of or with our economic recovery partnership, which includes a range of partners across the public sector, private sector, including the VCS, particularly the university and Kirklees College have been involved from the skills perspective. And we've taken our people, partners, places approach and translated that to what that means in the economic context. So that's skills and jobs for people, it's businesses or employers for partners, and it's investment in our places. But we've also taken the two important cross-cutting themes: environment, recognizing that we have a climate emergency, but also inclusive economy. the way that we respond to this crisis needs to reflect those inequalities that we know and we already knew were evident in our economy, but that this crisis has really shone a spotlight on. And through the conversations that we had with the Economic Recovery Partnership, these 4 priorities at the bottom really came through. The importance of job creation, the importance of young people, recognizing that young people are always more heavily impacted by recessions, but that the nature of this recession will particularly hit hard. Digital inclusion and the involvement of the voluntary and community sector, because we've seen them be particularly strong during this crisis. We've built even stronger relationships with our VCS community, but we need to guarantee that they come through this stronger than they went into it. The council's putting together a £40 million economic recovery fund, and to do this, we're repurposing our property investment fund and startup and retention fund and prioritising other capital investments. And we're making sure that as we do this, we maximise the impact that these investments can have for the recovery. We're also continuing to look at how funding that comes from the government and through the West Yorkshire region can be maximised for its benefit in Kirklees. I don't want to go in too much detail over the initiatives. I know that the plan itself was circulated with the papers, and so it can be linked from the website as well. But I just want to highlight some particular areas which I think are important for our health providers. So that'd be particularly within skills and employment. What are the opportunities for apprenticeships? Since the plan was written in draft, we had the Kickstarter scheme announced, and particularly digital citizen basic skills rollout, and seeing the benefit of a population that has greater levels of comfort with using digital services and how that can have positive impacts for health services. While there's nothing that I'd specifically draw out here, I think the importance of having attractive places that people enjoy being in, living and working has a huge impact on well-being and mental health. So these investments are going to be important for health outcomes as well. In terms of an inclusive economy, I'd highlight the social enterprise and cooperative support program, recognising the importance of social enterprises within social prescribing and similar models, but also the development of a good work charter. In terms of building back greener, again, I'm not sure there are particular elements that I'd highlight here, but simply noting the importance of air quality for particularly respiratory health. Yeah, sorry, I thought I'd lost a slide there. So the 2 questions that I'd particularly like to ask the members are obviously for your general views on the economic recovery plan as it's been presented, but also what actions partners are pursuing that support economic recovery or the broader inclusive economy objectives.
Thank you very much, Jonathan. Well, ladies and gentlemen, your chance to either ask a question or comment on the plan or tell us a little bit about something that's happening in your organisation. Have we any takers for any of that? I'm not seeing anything, if anybody else is. I suppose one thought that occurred to me, Jonathan, while people are thinking about this was that very often we, as large organisations, we commission all sorts of things, and we often commission and replace services, and because it's cheaper. But I wonder how often we look at what that means for the people who are employed by that organisation, whether that's low pay or whether it's zero contracts, 0 hour contracts and what have you. And I do think there's a sort of, we can step so far but no further if we're going to address economic recovery properly for the community. So I have several people here now. Tim Breeden, I think you were the first one who put something in the speech.
Thanks. Thanks very much. Yeah, thanks for that, Jonathan. That was helpful run through. Good to hear it summarised like that. It was just a couple of points really. One was making sure that I guess we all acknowledge the role that public services have in supporting people back into work. And showing some leadership around that, particularly for people who struggle to get into work and need additional support. And I think we could all probably point to schemes and initiatives where that has happened, but we clearly need to acknowledge the need for that to continue, and we shouldn't lose that despite the current pressures. And the other thing that I think is probably important to note, and again it's referenced within the paper, is the role of the voluntary work in terms of as a step on the employment ladder. And I know we do a number of things, and we do it as an organisation. I'm sure others do as well in that regard. But those are the sort of things that I think in the current climate could easily get lost. Those things slip down the ladder. And I think I think that there might be something there about highlighting the role of public services in supporting people who struggle to find work and need additional support, and the role therefore for us, in leadership, in modelling that wherever we can. So just a couple of points from me. Thank you.
Thank you. Steve Ollerton.
Thank you, Councillor. Yeah, good presentation. Thank you, Jonathan. I mean, just NHS obviously a very big employer in Kirklees, and actually, I do consider myself lucky that I haven't been affected by unemployment or anything like that, and none of my colleagues have either. And actually, if anything, the health sector is probably going to be recruiting as we go forward. So while I know this talk isn't about how we can train and recruit people into the NHS, it's certainly something that people should consider. And certainly, as Tim said there about volunteering, there is the mental health aspects of volunteering. If people have found themselves out of work, then actually sitting around in your house is not necessarily that good for your mental health. So getting out and doing that, and as he says, then that can be, if you choose the right avenues, may unlock some employment further down the line. Thank you.
Thank you. I don't know at some point when people have spoken whether you wanted to come back, Jonathan, or shall I just keep going on? With several people wanting to speak.
I think these comments are really helpful. Okay. And unless there are direct questions, I'm happy for people to just make those comments.
And that's fine, thank you. So Helen Hunter to speak next.
Hi, just a point that is coming up in our discussion with people with long-term conditions and disabilities is around the fact that many people are fearful that if you are somebody who may be asked to shield in the future as a result of sort of worsening conditions with COVID-19, that actually it makes you less employable because you are more likely to be sort of limited as to where you can go out to work, and how actually often people with disabilities already struggle more significantly with getting into sort of stable, long-term, sort of valuable employment. So I think there's something to consider about that and the potential for that in widening inequalities. I know also people who have childcare responsibilities, if they need to be off work to look after children, actually also that makes them feel like they might potentially be less employable and more open to sort of some discrimination. Not saying that anybody would be actively doing that within these forums, but I think perhaps it's something that we can take a really strong position on and sort of say, actually, you know, we are very much an employer that supports people who might face some of these challenges.
Really good point, I think, Helen. Thank you. Phil, you wanted to make mention of the integrated workforce strategy?
Yeah, because we haven't brought this to the Health and Wellbeing Board thus far, but there is actually an integrated workforce group that's got representatives from all the organisations involved in the Health and Wellbeing Board that's looking at things we can do as a set of employers to make sure that the health and care sector is pulling together to do what it can. And we identified 3 priorities: improving the well-being of our workforce, recognising that we need to look after our own. Second one's around promoting jobs and careers, and we're doing some work with the Careers Service to make sure that when it comes to promoting jobs and careers for young people, we're actually promoting the health and care sector across Kirklees as opposed to all trying to do that separately. And the final one's about integrated and sharing our learning and development activities, which again is something we're trying to do to sort of embed that idea that people are working for the system rather than individual organisations. So I thought it'd just be important for people to know that behind the scenes there are people working about trying to connect a lot of things up that hopefully should help with some of the issues that Jonathan was highlighting.
Yeah, I think that's really important. Thank you, Phil. Emily Parry-Harris.
Thank you very much, Councillor Kendrick. I'm sorry my background isn't blurred. It was earlier. I'm very sorry. Jonathan, you'll be no surprise the comment that I'm going to make. I'm really pleased to see you using the slide that actually takes us across the whole kind of way in which people live their lives, that, you know, people who are living in poverty are more likely to undertake particular behaviours, which means they are more likely to present with particular health conditions. But we also know that not only that those people are more likely to have those health conditions, there is more work that we need to do to make it so that there is equity in terms of how people present with those health conditions. So when we are talking about achieving equality for our population, there's a whole range of inequalities that we need to work across and impact on. But I'm really, really pleased that we've got poverty up there kind of front and centre as a thing that we are going to talk about. Thank you.
Thank you very much, Emily. Catherine Riley.
Hi, thanks Jonathan for your presentation. I'm from Calderdale and Huddersfield Foundation Trust. So a really interesting question: what actions are we taking to support economic recovery? I think our focus has obviously been on care and service provision, but as a big anchor organisation in the local borough, I'm not sure we've really addressed that question and thought about what actions we can take to support economic recovery. So we'll take that question back into the organisation. So thanks for the challenge. Fantastic.
That's an excellent promise then, Jonathan.
I can't promise to do anything about it, but I will take the
the more it's discussed, the more it leads to solutions, doesn't it? I'm not seeing anyone else asking to speak at the moment. Can I just ask one question, please, Jonathan? You talked about youth unemployment on one of the slides being at 3,910. Which is a big number, but I don't know how that relates to what it was before, or, you know, have you any idea as to what sort of volume increase that is? I assume it's an increase, or?
That's a good question. It definitely is an increase. I've not got here what the figure was prior to the pandemic, but that is, as a percentage, that's an unemployment rate of 10.4% for that group. So to compare that with the national picture this week, we were looking at 4% or 4.1%, I think it might have been, across the board. So that gives you some idea of the comparison.
So it's more than double as such, yeah.
Yeah.
That's very significant. And just to indulge myself once more, the 85% increase in benefit claims, and some of that will be because people were furloughed or their jobs had ceased, businesses had closed and so on. I suspect that as time goes on, the number of benefit claims will continue to increase because of, as we get flare-ups, and we're hearing about lots of businesses that are suddenly going to the wall. They've held on and kept going, and they've had to give in. I am concerned about a huge increase in the number of benefit claimants and what that will mean for individuals. Yeah.
Did you want me to respond to that at all?
Well, if you want to, but I mean, I was making a statement because it is a worry.
That's definitely a concern, and we'll be looking at those numbers as well as unemployment, economic inactivity, and those kind of things as those stats become available. But I know that colleagues are working very closely with Job Centre Plus and other stakeholders to make sure that we're well prepared for those changes.
It's the sort of knock-on impact of that bothers me. I mean, it bothers me that people are reliant on benefits as such, because it's not a good place to be. But, for instance, somebody who has a mortgage and you're on universal credit, the benefit doesn't in any way help you pay that mortgage. So we're very likely to see people who are losing their homes, and levels of demand on the need for homes from the council and elsewhere are likely to increase to perhaps a level that no way can we meet. When you look at the number of people on the housing waiting list, before COVID, it was running at about 11 or 12,000. The last time I looked, and it's a month or more ago, it was at 17,000. And, we have between 150, 250 properties, council properties available in any 1 week. So it's a bit like a time bomb ticking away there. It really does worry me. Sorry. Anyway, I'm indulging myself, and Councillor Musrat-Khan would like to speak.
Thank you, Councillor Kendrick. I do share Councillor Kendrick's concerns as well, especially people who fell short of the furlough system and have ended up in dire straits and as new claimants and have mortgages to pay, which they're struggling with, and a number of residents have contacted me with regards to that. Now, I just wanted to ask a question about inclusive economy. The providers and partners and businesses that we have that relationship with, do they then sign up to this inclusive economy agenda, and and does it become like a snowball effect where they're encouraged to try and recruit locally and use local providers and services and businesses as they are on board with that partnership with us?
Thank you for that question, Councillor Khan. There are a number of ways in which essentially the agenda is kind of passed on, and I think it's a big process of actually having that discussion about the inclusive economy agenda, and including in forums like this today, and allowing different organisations to understand the different issues, different ways in which they can act, and helping them to get on board with those. In different aspects of the programme, I think the mechanisms are slightly different. So, for instance, within the council's own procurement, we're starting to use the social value portal. And as part of that, some of the indicators that we can ask organisations sign up for that are going to supply services or products to us include what is the percentage of procurement within your supply chain that comes from local suppliers within the Kirklees area. How we get different organisations on board to something like the Good Work standard that is proposed within the Economic Recovery Plan will be different, and that will be a process of conversation with different organisations to explain the case for Good Work and the benefits that that brings to them in terms of recruitment, retention, and their reputation. But also there are other mechanisms, such as through the business growth funding that's available through the West Yorkshire or the LEP programmes, which, as I understand it, and my colleague Andrew Sharp, who's on the call, be able to explain much better than me, I imagine. As they are given grants, they must, as a result, take on one or two different measures in improving the work standards or other essentially social value commitments that they make. Andrew, would you want to add anything to that, or was that a reasonable explanation?
Well done, Jonathan. I think that's a very reasonable explanation. I mean, in terms of some of the detail of those things, we're actually also applying that to any additional funding that we might make available to businesses through things like the startup retention policy. So some of the things you might see in there, and it's a list to choose from rather than it being all things. So I just realised my microphone was up. But you're looking at things like signing up to ensure that minimum wage requirements or living wage requirements are met, and things like working with schools or offering extra training and skills plans, things like that, opportunities for locals with disabilities or health issues to be employed. So it's a bit of a list, and it includes some other things which are not directly health related, such as green travel or ensuring you're using local supply chains, that type of thing. But yeah, a series of different measures being put in place, which hopefully encourages those businesses to engage in that social value or inclusivity agenda a bit more than they otherwise might do.
I think Councillor Khan wants to come back with a comment.
I just want to comment that there are additional benefits to employing closer to where the establishment is in terms of the environment and less people commuting and less travel time. So there is that knock-on effect as well on air quality. I'm just a great fan of just try not to travel anywhere where I don't need to go.
Jolly good. I noticed Phil put a comment on the chat line that work's also being done to join up work on digital inclusion, which of course is obviously a key ingredient. I'm not seeing anyone else asking to make a comment or ask a question. So Jonathan, can I thank you for a very, very clear presentation. Thank you. Great. And really useful. And Andrew as well for your support. And the recommendation is for us to consider the economic recovery plan, which I think people have been commenting on. And I think people may well need to take away those thoughts back to their own organisation, as has already been offered by one member here today. But thank you again for you coming along today and your presentation. Thank you.
Thank you very much.
Okay.
Thank you. Bye-bye.
So we move to item 8, which was a COVID-19 update presentation, and it's not by Rachel Spencer-Henschel. I know this is by Emily Parry-Harris. So Emily, over to you.
Thank you very much, Councillor Kendrick. Olivia, I think you're going to share the slides for me, aren't you? As if by magic. Thank you. So I'm going to give a very brief update on the COVID position in Kirklees. I think most board members will be receiving this data in various different forms and in various different meetings, but it would have been an odd thing to not to have talked about COVID in the Health and Wellbeing Board today, wouldn't it? So next slide, please, Olivia. Okay, so this is our cumulative position in Kirklees. We now have had a total of 3,260 confirmed cases, 188 of those being in the last week. That's the highest number of positive test results we've seen for quite some time, so things are creeping back up. The board will remember that for a little while we were in the top 10 worst performing local authorities in the country. We're now no longer in that position. Our latest weekly rank is 26th, but I think we need to be very cognizant of the fact that that's not necessarily because things have got better in Kirklees, it's because things have got worse elsewhere. Although, having said that, we are not seeing the massively rapid surge in numbers that places like Bolton are seeing. We are seeing a steadier increase in Kirklees. So we're doing something right, but let's not be too congratulatory. These numbers run to the 10th of September. So they're about a week out of date, but it shows a pattern of increasing numbers. Next slide, please, Olivia. Okay, so this is the current position in Kirklees as compared to England and the Yorkshire and Humber. The line that you'll be particularly interested in for Kirklees is the blue line. You'll see that, broadly speaking, the angle of that line follows the same angle as other places in the country. So we are certainly seeing a level of increase, having seen a relatively flat line up to a couple of days ago, a couple of weeks ago. Thank you. Next slide. Okay, so this has been all over the news in the last few days. We have got significant issues in terms of the access to testing, and I'm wondering if that's the thing that Dr. Ollerton is going to want to comment on. There is high demand nationally for testing, which means that we are struggling to get the testing capacity that we need in Kirklees. And it's not just about being able to get the test and have the swab and have people present for testing. It's about the capacity in the labs to process those tests. It's absolutely beyond our control, and the work is being done nationally to rectify those issues. The way in which people should access a test is still through the government's website or by calling 119. But we are being very, very clear that we are only asking people in Kirklees to get tested if they are symptomatic. And those symptoms are a high temperature or a new continuous cough, and this should be an or, not an and, or a loss or change to your sense of smell or taste. And only if you have one of those symptoms should you book a test. That doesn't apply to the asymptomatic testing that we're undertaking in care homes, but for the general population, we are only testing where people have a test. And then being very, very clear that if somebody does start to have symptoms, they must get tested, and that the household must isolate whilst they wait for those results. Thank you. Next slide. Okay, so the picture of testing in Kirklees splits into three distinct areas. We've got the mobile testing units. These are drive-through sites. They are based in our communities, and the samples are sent to labs for processing. All of these mobile testing units are by appointment only, and currently the locations are in Batley, Holmfirth, Dewsbury and Fartown. The location of the mobile testing unit is at the discretion of the Director of Public Health, and we will work to redeploy into areas requiring additional testing capacity. The local testing sites, they're walk-ups. They were initially just, you would present for testing without booking. What we're having to ask people to do now, in recognition of the lack of testing capacity nationally, is that those should now become appointment only. And then I've made reference already to the asymptomatic testing that's taking place in care homes. Thank you. Next slide. Okay, so a little bit more detail on the care homes. This is a significant piece of work for us. All residents are being tested monthly and staff are being tested weekly. It's been a very, very specific national decision to focus the attention on the testing in the care homes, because that's about protecting those people who are most vulnerable, age continuing to be the most significant predictor of a poor outcome from COVID. Thank you. Next slide. Okay, so we've got a huge range of different pieces of work in place that are supporting our response to COVID. We have a local outbreak control plan, which had previously been brought to the Health and Wellbeing Board when we thought an outbreak would be, you know, a few more people with flu. I don't think we ever quite imagined that we would be responding to something quite on this scale, but you have seen that outbreak control plan previously. There's a comms strategy that runs alongside our response to COVID, and actually I think the quality of the comms that's coming out of the local authority is really good. Marcus is doing a great job with that. We have a weekly process of reviewing the data and looking at where we are seeing increases in our numbers, and then deploying community protection plans into particular areas. So we currently have work ongoing in Batley and Dewsbury, and we're watching another couple of local areas where it looks like the numbers are going up. We're trying to do that in a very kind of planned and reflective manner, so that we're not just knee-jerking and we're not bouncing about all over the place. We're looking for trends and we're looking to deploy resources for a period of a couple of weeks, so that so as I said, we don't just bounce around all over the place. We have the Health Protection Board, who are overseeing significant amounts of the work, and I know that Councillor Khan, you've been at Health Protection Board just before joining the Health and Wellbeing Board, haven't you? And then there's the Outbreak Control Board, which is a cross-party membership board that's overseeing the work that we're doing. Next slide, please. Okay, I thought it would just be worth, because we talk about outbreaks and incidents as though everybody knows specifically what an outbreak and an incident is. And I thought it might just be worth putting this slide in so people have got it as a point of reference. I don't propose talking through all of it, but an incident is when two or more people experience a similar illness are linked by time or place. So it's quite a specific definition, but I'm just going to leave that slide with you and you can read it at your leisure. Thank you. Next slide. Okay, so PPE has been a significant issue for us in responding to the pandemic. Phil PPE Longworth has been taking a significant role in making sure that we have the supplies where we need them. We've managed in Kirklees, we've managed the West Yorkshire LRF emergency supplies on behalf of those authorities, and we've worked really well across those local authorities as well. There have been emergency supplies provided to all of our communities, and we hold the emergency stockpile in Kirklees as well. I think it would be fair to say that PPE has caused a number of people a number of headaches, and if everybody could touch wood at this point, the plans that are in place around PPE and the supplies of PPE are now well established. There are significant costs associated with PPE. Next slide, please. Okay, so in terms of the lessons learnt, we're 6 months in now to responding to the pandemic, and we have learnt an enormous amount about how we need to do this. The first bullet point is the most important. We really do need to do early engagement to work with communities. The principle that we have in Kirklees of working with, not doing to, is really, really important in how we respond to this pandemic. The relationships that we have with local communities, with local businesses, with schools and care homes is absolutely vital. The way in which our IPC team have been able to give specific advice to schools because they know those places has been very, very important to us. Again, I'm not going to read through all of those in detail. The information's there for people to take away, but the community languages has been incredibly important as well. Some of the messaging that is going out around COVID is incredibly complex. And I have to have a crib sheet that I refer back to remind myself. So how we can expect the general public to keep this in their heads at all times, I don't know. So it is complex and complicated, and community languages are incredibly important. Thank you. Next slide, please. Okay, so ongoing considerations. I've mentioned PPE. There is an online portal now open for PPE to be used by adults, children's services and primary care. And the operational management of PPE will change, or has changed from last week. But as I said, I'm more confident than I was that the supply of PPE is robust. Seasonal flu planning is a new, well, not new, we knew that winter was coming for quite some time, but the approach to seasonal flu really important this year. And I was on a call that Dr. Ollerton was on yesterday with the CCGs, where we were talking about the importance of the flu vaccine. It's always important. It's more important than it ever has been this year. And all of the efforts that we're making to try and keep the rates as low as we possibly can in Kirklees are about protecting the NHS for that potential and possible second wave. I think that's my last slide, but it would be remiss of me if I didn't take the opportunity to remind the Health and Wellbeing Board of the 6 key messages that I think everybody needs to have in their mind. Hand washing remains the most important thing that we can have in our toolkit to help us deal with COVID. So we need to continue to talk about hand washing. We need to continue to talk about social distancing. We need people to maintain 2 metre social distance where possible and 1 metre where it isn't. We need people to isolate if they become symptomatic. And I mentioned earlier in the presentation, those symptoms are a new or continuous cough or a high temperature. And by high temperature, I just mean if you feel hot, if you put your hand on your own chest and you feel hot, we don't need people to have thermometers for that, and a change to your sense of taste or smell. And it's one or other of those things. It's not and. It's incredibly important that people limit their social contacts, and that you know who you've been in contact with in case you need to give your details to test and trace. I don't know what everybody else is like, or I don't know whether you could in normal times remember who you'd been within 2 metres of in usual circumstances. I certainly couldn't, but we are asking people to limit their social contacts. And then we are asking people to be tested if they are symptomatic, notwithstanding the points I just made about the difficulties with access to testing. And then the last point is around the use of face coverings, particularly when using public transport or out and about in places where 2 metres social distancing cannot be maintained. And I think that was my last slide, Olivia.
Excellent. Thank you very much, Emily. It's you were strongly putting over those final messages. Now then, Dr. Steve Ollerton.
I've said them a few times in the last.
You have indeed. You have indeed. Dr. Steve Ollerton has been very patiently waiting to speak. He wanted to speak, I think, by about slide 1 or 2. So you may be going backwards. I don't know. Steve, can you remember what you wanted?
Thanks, Emily. Obviously, I echo your points that people need to remember. I have a few things actually. The first thing is, I know the graph of cases, shows that the cases are going up and all that, but I do worry that we're not comparing apples with apples here, because back in April time, we weren't testing lots of people. So there were probably thousands and thousands of cases that we weren't actually testing. So actually one end of the graph is not the same as the other end of the graph. And I do think that this is a national problem, that we're creating a little bit of hysteria here by having this, we have to be aware that right back then I was taking many calls a day from patients. I didn't have access to any tests. I was just telling them to self-isolate, stay at home, yes, you've probably got COVID, you know, and all of that. And they're not in these figures. So I think, you know, one end of the graph's not the same as the other. I just wondered, how quickly can the Director of Public Health actually respond to spikes and things like that? And what authority does she have to actually put wards back down into lockdown? And I only say this because I obviously live in the Denby Dale area, and I'm actually a little bit worried that we've got quite a lot of cases around here. There are 4 schools in the Skelman-Thorpe area now which have got bubbles that have been sent home because either staff or patients, or not patients, what they call pupils.
Pupils, we call them pupils.
Who've got COVID. I mean, I know it's only anecdote, but I now know more people who've got COVID than I've known in the last 4 or 5 months. And yet here we are. So I just wonder, you know, how closely do we monitor that and actually maybe make some bold decisions?
Okay, so if I take your first point first, around the data, you're absolutely right. One end of the graph is different from the other end of the graph because the level of testing didn't exist. However, testing people doesn't cause them to have COVID. Testing them just finds out that they do have COVID and allows us to put the requirement in place that they self-isolate. So the only way we are going to reduce the level of virus circulating in this population is by knowing who has got it and asking them to isolate. So people will have heard a lot about the R0 rate over the duration of this pandemic. There are 4 elements that make up the R0. This is a test for myself now, I shouldn't have started this. There's the duration of the infection, there's the opportunity for the infection to spread, there's the likelihood of transmission, and then there's a 4th bit, and I can't remember what it is, but there is a 4th bit and it will come back to me. The only 2 things that we actually have control over in terms of what influences the R rate are the opportunity for transmission and the susceptibility of the population. And the only things we have in our arsenal to deal with that is hand washing, social distancing, and people limiting their social contacts. So yeah, I take your point about the data and it not being the same from the start of the pandemic towards the end, and the level of testing being different. But testing doesn't cause people to have a virus. Testing just shows where people do have it. And then your second point about the Director of Public Health's ability to influence more localised lockdown, that would need to be something that was done with support of elected members, and that's exactly what the local outbreak board is intended to do. So I made reference to the conversations that we're having locally every week, looking at the mobilisation of the community protection plans. Denby Dale is one of the areas, as you've mentioned, where we are seeing an increase in rates, and we're particularly seeing an increase in older populations in Denby Dale as well. Public Health England refer to it as stacking. So to start with, the increases in rates were in younger age groups, and they are moving into the older age groups now. So the Director of Public Health would work in partnership with the Outbreak Control Board, and they would make a decision. I think, and I would need to double check this with Rachel, I think before Rachel was able to actually make the decision and say that there was going to be local lockdown in a particular ward, she would need the support of the Secretary of State.
Right, okay. Oh, well.
I need to check that. So if you'll allow me just to double check that one, but I think that's what the process would be.
Thank you.
Thank you very much. Helen Hunter wants to speak.
Hi, it's just something that's in my mind with regard to the testing stuff. We're getting quite a lot of questions from members of the public who are struggling to make sense of exactly what's going on, and I think people have been compelled to go and get tests for a period of time and are now being told, no, if you've not got symptoms, you don't need a test, and I think that's quite a hard thing to get your head around. But the concern that I have relates to the changing kind of walking capacity. And I realise that this isn't just Kirklees' issue. I realise this is a national issue. I'm very mindful that there are lots of people who have the skills to put themselves at the front of the queue in terms of getting access to services, and they are not the people who face the greatest health inequalities. And I have some concerns about how we're ensuring that the people who might be most at risk as a result of COVID-19 are actually the people who are most able to are still able to access testing. If we're saying you've got to be able to book online, ring in and get an appointment, rather than having some of that walking capacity. So it's just something that's a concern for me. I realise it's not just Kirklees' concern, I suspect.
I entirely and wholeheartedly agree with you. It's not within our gift to increase the testing capacity, but it is something that we are specifically and frequently feeding back up the national chain, that we need to have access to testing that people can access almost on spec, without that need to put a whole load of things in train before they access the test. And we cannot end up in a situation where somebody in Kirklees who needs to access a test needs to go to Aberdeen, which was the option that was offered to a colleague earlier in the week.
Interesting. Mel's put a comment up.
Yeah, Mel, that was, I was 98% certain that what Mel said was true, but I needed to confirm that 2% of doubt. But thank you for that, Mel.
Okay. Could I just ask about flu vaccines, please? I mean, it is an important thing every winter, particularly people who have conditions that makes them vulnerable or with age and so on. And I think a lot of members of the public have really got that message in the context of COVID-19. Have there been plans to ensure that there's enough flu vaccine available?
There are plans in place to make sure that we can support as many people as possible to access the flu vaccine. We've always had enough flu vaccine to meet demand previously. Whether there will be demand that outstrips supply this year, I don't know. Dr. Ollerton has put his hand up. I imagine he might have a view.
Go on then, Steve. You want to comment on that?
Yeah, I mean, the first thing to say is practices have ordered vaccines for all of their elderly folk, as well as anybody with long-term conditions, and that will cover a huge proportion of people who are more vulnerable. So they will all get their flu jab. And the NHS England have been quite clear that this 50 to 65 cohort that they are potentially going to offer the flu vaccine are not to be vaccinated at the moment. So you can't just turn up and try and chance yourself and get one. I don't actually know what the plan is for that extra vaccine, but I'm assuming they've gone to the main suppliers and said, we need a few more million. But we have been told that we are not to be vaccinating anybody outside of our normal cohorts and the shielding and all of that up till the end of October, and only from then will we be potentially then doing an expanded group. I think they are expecting flu uptake to be about 20% more than usual, because as we know, although we offer the flu jab to all of the people that you expect, you only get about a 70% uptake or something like that, but they do think it'll be more than that this year, probably more like 80%, even more maybe. So most practices have ordered it accordingly. But the main thing we need to do is us and community pharmacists and any employers that offer this, need to make these as available as they possibly can, make it easy for people to get jabs if they qualify. But I don't immediately have a concern that there won't be enough supply of vaccine at the moment.
Thank you, that's really helpful, and hopefully all of the things that we're doing to impact on the circulation of COVID in the population, the hand washing, the social distancing, will also impact on the level of flu that's circulating. It's certainly having an impact on the level of diarrhea and vomiting and foodborne illness that's circulating in our population, because who knew washing your hands would help so much.
Yeah, good point. We might have to carry on doing it.
Absolutely, it'll catch on, you know.
Indeed. I mean, I'm comforted by what Steve Ollerton says, because on a personal basis, in trying to seek a flu vaccine, because I'm in one of those cohorts, Steve, I'm told that they've run out. It's part of the instigator for me asking that question.
Well, you can come to my surgery and have one if you like, Councillor.
Can I? Fantastic. Have any other questions or comments from members of the board, please? I'm not seeing anything else. Oh, yeah. Oh, Councillor Pattison is boasting she's had her flu vaccination. Dear me, one-upmanship reached a new height. Could I just ask about one of the headings on your presentation? It said Kirklees Test and Trace Group.
Yeah.
Because I'm really confused about test and trace, because I thought this was some sort of national activity. Is this a local activity then? Could you just explain that, Emily, please?
It's both and.
Right.
So there is the people who receive a positive test will be contacted by a national team and asked for the details of the people that they've been in contact with. If that case is deemed to be straightforward, that will be managed by the national team. If the person has been in contact with people and it's deemed to be less straightforward, or that person works in a health or social care setting, and there's various criteria, then the tracing of that will be passed to a local team.
Okay, thank you. That's really helpful. People
I feel the need to fess up that I haven't had my flu jab yet, but I will, I promise.
All right, that's good. Keep washing your hands in the meantime.
I will.
Thank you very much. Will copies of your presentation come out to board members as
yeah,
well?
they can do. Olivia has a copy. I'm sorry they weren't circulating in advance, but the data is changing so rapidly. It
Absolutely.
Didn't make sense to do that.
We know it's a snapshot in time, but it just helps me, and I'm sure other colleagues sort of understand some of the steps and complexities.
Certainly, no, I'm happy for Olivia to circulate the slide deck after this.
Okay. Oh, and it's on the Kirklees website too. It says on here, so that's useful. I suppose I should make a comment that Dr. Ollerton is delaying his flu vaccine, so everybody over 65 can have theirs first. I'll put in an advert for him there. Emily, thank you so much for that presentation.
You're really welcome.
That was really very useful. Thank you very much. Thank you. So, could we move on now to item 9, please, which is the stabilisation and reset phase 3 planning. I've just got a problem that I can't move my mouse up as such. And I think Natalie Ekrod is going to do this presentation for us.
That's correct. Thank you, Councillor Kendrick. First of all, apologies that I'm unable to turn my my camera on. It interferes terribly with the connection. So apologies for that. I do have some slides that were circulated with the papers. Are they going to be put up on the screen, or? I'm
looking at Olivia and Jenny to know whether that's been provided or not.
I'm happy to make a start without, given they were part of the papers, if that's what you'd like me to do.
Yes, Chair, we assume they'd be part of the papers, so they won't be available on screen.
Okay, that's not a problem. So the slides were circulated. So if I just take you through those, if you have access to your papers. So further to the NHS planning letter that was received on the 31st of July and the much awaited publication of the planning guidance, the headlines from said guidance was that the NHS EPRR incident level was reduced to a level 3, with effect from the 1st of August 2020. Like very old news now. And whilst recognising the new challenges of overcoming the current COVID-related capacity constraints, discussions have been had and are ongoing with patients and clinicians, of which have helped inform what the NHS priorities are for the third phase of stabilisation and reset. So in summary, those priorities are A, returning to near normal levels of pre-COVID activity, B, preparing for winter and any further potential COVID spikes, and C, doing A and B, but retaining any good practice that was adopted during COVID, while still supporting our staff and also taking any necessary action to identify and reduce inequalities. So in terms of the planning process within Kirklees, it's led by myself with Vicky Dutchburn as the SRO. And we've got a well-established planning team within Kirklees. We've got systems and processes that have been set up and used for a number of years now. And we engage and meet regularly with all the partners in Kirklees in different forums, meetings, as well as basic virtual exchanging of data as well. So as part of this planning process, all providers and CCGs were required by NHS England and Improvement to submit an activity plan. That was to cover elective and non-elective services for the remainder of this financial year. And a draft was produced and submitted on the 27th of August. And actually just today, we've submitted our final plans. At a really high level, Mid Yorkshire Hospital Trust has submitted a plan that is compliant with the asks within that planning guidance. Calderdale and Huddersfield Foundation Trust have submitted a realistic and deliverable plan. It doesn't meet all of the requirements month on month set out by the trajectories, but largely by March, it is compliant and achieving the national standards that have been set. For South West Yorkshire Mental Health, again, we've submitted a plan that's largely compliant, but it's also thought to be deliverable as well. In terms of the key points to consider, both trusts are continuing to refine their plans, even though we've submitted what we feel is a final plan today. We will continue to refine and discuss these plans and see how they aggregate up to an ICS level. Both of our trusts have focused on cancer services to ensure that they're back up to the pre-pandemic levels. And we anticipate that the non-elective activity levels will and are in some cases already back to pre-COVID levels. Both trusts have worked very hard on their elective care services and the re-establishment of elective care working groups, and specifically undertaking processes working with our primary care colleagues to review patients that have waited over 22 weeks already. We are just looking at the outcome of that piece of work. I think just in terms of the last few points, in particular for mental health, the trust have done a really detailed piece of modelling where they've looked at referrals and contacts to be able to model pre-COVID and post-COVID detailed work. No services were actually stopped during COVID, although a number of them were delivered differently, and the urgent cases were seen by our mental health trust. We have seen locally that from August we've seen an increase of about 20% of the pre-COVID level activity, and actually that's backed up by the national picture, and we've seen that elsewhere as well. It's agreed that the mental health investment standard is required for the remainder of the year to help meet that additional demand that we've seen. And the Trust is really committed to continuing with good practice that's been adapted during COVID. In particular, that's the use of more technology through some non-face-to-face consultations. Just lastly finish with the timeline. The timeline in the paper actually needs a couple more ticks next to it because, as I mentioned earlier, we have submitted the final templates just this morning with regards to those plans. We will get some feedback over the coming week. As I said, the individual provider and commissioner plans are aggregated up to an ICS level for West Yorkshire and Harrogate. And the only other thing to probably just to highlight within the timeline is that one of my colleagues is also working on the submission of the local people plan. Okay, I'll stop there and if there's any questions.
Thank you, Natalie. My apologies to, I've got an echo going on here. My apologies to members of the public that we didn't have that to put up on screen, but I think the way Natalie explained it was really very clear. It didn't really need people to be able to see the written document as such. So questions or comments, colleagues? I'm not seeing any. Aha. Tim, you're wanting to speak.
Hi, yes, thanks very much. Thanks for that very much for that summary, Natalie. It's really helpful. And as you say, Councillor Kendrick, I think it was a good summary for those that couldn't see the slides or had access to the paper. What I would just like to stress there is that the challenges of undertaking the planning that was required with the uncertainty around the financial allocations and how much that obviously has a significant impact in terms of what can and can't be done. That situation is now resolved, but that really is the missing piece of the jigsaw that Natalie is referring to in terms of those last pieces of planning that need to be done as a result of that situation. So I think everybody needs to be aware of that. The second thing that I think is really important to stress, and from our perspective, is that we have tried to do whatever we can do around maintaining face-to-face throughout this pandemic. And we have obviously used digital solutions like everybody else, but we are also alert to the fact that digital doesn't suit everybody. So we need to take that into account in our planning. And also we need to take into account the fact that we know that we shouldn't, assume that just because we've been doing something during the pandemic and we've managed and things have gone okay, that's sufficient for the future. We need to take a long, hard look at what we're doing now and plan in a different way. So we're not just into responding now, we're into planning, which means that we need to take account of what we've learned and use that in the future. And I guess that's going to be influenced clearly by the experience we've had around the benefits of digital for some people, but not for everybody. And that's particularly, but we know how important face-to-face contact and human contact is to people, particularly in some of the work that we provide support to, and we need to acknowledge that. So I just make those 2 points really: the difficulties around the financial planning arrangements, and the second thing about the importance of understanding digital is not for everybody.
Thank you very much, Tim. I think those are very measured comments, actually really useful. Emily, you asked to speak.
I did. Thank you, Councillor Kendrick. I agree with what Tim was saying about digital not being for everybody. However, there are some people who, I'm going to be very Pollyanna and cup half full in this next statement. There are some people who have really reported having a significant preference for how they are now able to access services, that they can, if they need a phone call from their GP or their hospital consultant, they can do it in the middle of their work day because it's just a phone call, they don't need to travel for it. That people have been able to have conversations, that they've been able to use technology to bring their family into, so that they're able to have conversations together without everybody needing to travel. So I think there is something about us being reflective and thinking about the positives that we've gained through this pandemic and keeping the good stuff.
I would agree. I could see Helen Hunter nodding both to Tim and to you, Emily, so she obviously agrees. Any other comments or questions, colleagues? Not seeing anything. Just a comment, I'm not surprised, but it is quite shocking. A 20% increase in mental health cases is quite phenomenal, actually, and I can imagine the challenge of dealing with that. Oh, I wish people would stop putting comments on that I'm not supposed to read out loud. Could I ask colleagues then to refer to the paper where we're asked to endorse the approach being taken to the stabilisation and resetting Kirklees. We've had some comments about the timeline and the work programme. So unless somebody's going to say no to me in the chat line or wave a hand at me, I'm taking it that the board does endorse this approach. Yeah. Natalie, can I thank you so much for a very clear presentation. Thank you.
Thank you. Thanks.
So if we move on then, please, to item 10, which I'm struggling to find in here. Which is the update on the Kirklees Health and Wellbeing Plan. And Phil, you're going to address this for us, please.
Yeah, I shall try and make it brief. So hopefully board members will remember back in September 2018, we produced our place-based plan for Kirklees, and that was signed off by the board. And then in March 2019, we refreshed it, and I think most people think improved it, because rather than it being 30 or 40 pages, it was a plan on a page, which the wheel diagram that we've included in the report as an appendix, which is our attempt to sort of sum up what are the key priorities for improving the way in which the health and wellbeing system works in Kirklees. The board will also remember there was a peer review in November 2019, and even though we've had a global pandemic since then, we have actually managed to implement one of the main recommendations from that, which was the development of the Integrated Health and Care Leadership Board. And there was a paper that came to the last board meeting to update people on progress with that. One of the key things that board is responsible for is actually overseeing our place-based plan. And so that the rest of what I've included in the paper here has already been through the Integrated Health and Care Leadership Board. So the proposal is to refresh the plan, because clearly things have moved on, but in the discussions that we've had, there's a recognition, I think, that the vision, the outcomes, the values and behaviours, all the other information we've included in the second appendix, probably still holds true. So even though we have had a extremely unusual event, the things we were trying to do before COVID hit are probably the right things to do at that sort of broad level. And we've also need to recognise we made some progress. So one of the key things we said we should do is develop primary care networks. We said we needed to make sure we've got a more coherent sort of community response for our most vulnerable people. We said we should start building some provider alliances, and we've made progress on those, both before the pandemic and during. But what we do think we need to do now is to refresh the areas of focus, partly to reflect the progress we've made, partly to reflect the fact that the context has changed. And in the discussions we've had so far, there's been a real desire to make sure we're making the connections as strongly as possible to the inequalities plan that, again, there was a paper at the last board meeting about the emerging ideas in that. We've had a discussion today about the economic recovery plan, and we need to make the right connections with that, particularly around inclusive growth and digital inclusion, the topics we've already covered today. So the discussions that we've had thus far about what our focus should be going forward is partly informed by the fact we don't want to rewrite and just regurgitate all the existing plans, so we don't need to reiterate what's in the stabilisation and reset plan that Natalie's just been talking about, for instance. So it is about highlighting those things that demand a coordinated effort across a wide range of partners. And so the things that are emerging from the discussions thus far, and it would be really valuable to have the board's perspective on this, are how we're building on the success of our community response that we've created through COVID, recognising that the particularly vulnerable people will need a continued level of support, both during the what's left of the pandemic, but probably on an ongoing basis. The pandemic has brought to the fore issues around inequalities, and a lot of that's going to be covered in the inequalities plan, and we're bringing that back to the board to the next board meeting. But there are particular issues that have come out around inequalities in access and outcomes in relation to health and care services that we think needs more attention. We've spent a lot of time and effort over the last few years trying to build the different elements of an integrated health and care out of hospital model, and that we still need to make more progress on that. And we've had discussions at the Integrated Health and Care Leadership Board and the Provider Forum about a framework for doing that work, and we're keen to progress that. And a critical part of that is about provider alliances, and that's really reflecting the fact that there's the climate has changed across the health and social care system, and there's an awful lot more emphasis now on the importance of alliances across the individual organisations that are responsible for the care and support, particularly of our most vulnerable citizens. We've got two really good examples of where provider alliances have started to develop, one around end of life, another one around mental health. And there's a real enthusiasm for building on those and developing other alliances to cover different parts of the system. So those are some of the emerging areas of focus. The final thing to cover off in the paper were just a recognition that the board's got a couple of statutory duties. One's around making sure we've got an up-to-date and useful joint strategic needs assessment. Myself and Emily and Owen, who leads on the joint strategic assessment, met about this recently, and our reflection was that what we really need to do is to reflect the fact that inequalities are much more important now than they ever have been, and us understanding those inequalities and how they're affecting people. So the proposal is to make sure that the Joint Strategic Needs Assessment, or JSA as we call it, because we're trying to include assets, not just needs, is updated, and we bring a regular overview to the board for the board's endorsement. We want to do that, but have a particular focus on inequalities. So we've all got a very clear view of what the inequalities are that are being experienced across Kirklees, and how we can use that to inform our planning and thinking. And the second thing is just a recognition that we need to start thinking now about the joint health and wellbeing strategy. For those people who've been on the board for quite a while, they might remember that we developed the health and wellbeing strategy back in 2014. It actually runs out in 2020, and we have got a duty to have a joint health and wellbeing strategy. And so certainly the view is from the people who've been involved in thinking about it, that rather than rush into that to make sure we've got something by the 31st of December, because we want to take an approach that's much more about co-production and engaging a wider range of people than perhaps we have in the past in thinking about what our strategy needs to be going forward, is we want to bring something back to the board early in the new year with outlining the process, with a view to making sure that during 2021 we have actually got an updated version of that joint health and wellbeing strategy. So it'd be really useful to get the board's reflections on those areas of focus for the health and wellbeing plan, and hopefully getting the board's support for the proposals around strengthened inequalities focus in the JSA, and the developing a process for the refreshed joint health and wellbeing strategy early in the new year.
Okay. Thank you very much, Phil. So I'm now looking for any comments or questions from colleagues. I'm still looking for any questions or comments from colleagues. I think Tim.
Yeah, it was just to cover. I think the areas of focus seem right, and I think we'd be foolish to try and rush a refresh in light of current circumstances. So I would support both of the suggestions that Phil's made there, because if we, I suppose there's two things. There's one thing about rushing it, and the second thing is about not having the opportunity to take all the learning that we've got to date, and it feels like we're in the beginning of the next phase of response to the pandemic. So it'd be foolish to try and second guess the outcome of that. So I think as long as we got something in place that gets us over the sort of the governance perspective, then it makes sense to me.
Thank you very much, Tim. Helen.
It's just a plea from me, really. I often feel, and I could be wrong in this, but that when time comes to produce a new strategy, we sort of go, right, well, we'll start here and we'll write a new document. And I'm always mindful that often a health and wellbeing strategy for our population will have some elements of it in this time round that it had last time, and that we don't spend the time considering what progress we made against the previous strategy and how our approach has actually worked. Because it would suggest to me, if we're facing a lot of the same issues, that actually it would serve as well to think, have we done the right things across the last 6 years whilst we've tried to implement this strategy? And that has a really important role to play in what we might set as our priorities going forward. So it's just a plea from me for that sort of slightly backward look element when in that process that's been articulated.
I think that's a very valid point. Thank you, Helen.
Can I just come back on that very quickly? Because I did actually read the Joint Health and Wellbeing Strategy the other day, which was an interesting experience, because I must confess I hadn't looked at it for a while. And I must say I was quite reassured. We have actually spent the last few years trying to do the things that it says in the Joint Health and Wellbeing Strategy we should do, which I felt a lot better after I'd read it. Well,
perhaps we as a board also need to have that view then, don't we? So we can also feel reassured too. Yes. Thank you. And Steve's put a comment on feeling that your approach sounds good. I don't know if anybody else has anything else to comment or question. Not seeing anything. So colleagues, and there we go, Dr. Ollerton.
Yeah, I just had something to add. I was heartened by Phil's words there. But there's clearly going to be new things in town, aren't there? I mean, COVID's not going away, and environmental issues now are so much hotter and more prevalent than they were. I can't believe it, 6 years ago. But you know, so yeah, I mean, I agree with Helen. Let's look at what we did. Let's look at what we still need to do. But there's definitely new things that need to be added in as well. I mean, I think transport, that's going to be massively different. I think, you know, getting people on bikes and, you know, I mean, there's loads that we need to do. I actually quite look forward to that. There'll be something to look forward to in the new year. Let's face it, 2020 has been a bit of a write-off. So 2021, let's do it. That'll be fine.
Okay, so if I can ask members to, the proposal and next steps is under 3 on page 47 of your documents, and the actual recommendations are on page 48. So we're asked to comment on the emerging areas of focus. I think people have made some comment there. We're asked to be, are we happy about the health and wellbeing plan on a page coming to the November board? I don't think anybody's going to disagree with that as such. And approve the proposed focus for the JSA, which is on page 47, and approve the timescales, which is about taking our time to get our next joint health and wellbeing strategy as good as it can be, so moving that over into the new year. So unless somebody is going to protest at me, and I'm giving you all a chance to say, hey, nothing's happening. I'm taking it that the board is happy with that as a conclusion and the recommendations. So thank you very much for that, Phil. And actually, thank you to all of you who participated today. And if I can remind you that the date of the next meeting is the 26th of November 2020. So thank you very much for your time, and this meeting has now come to its conclusion. Thank you very much.